This video will discuss radiotherapy for prostate cancer. It contains the same information as the printed booklet called Radiotherapy for Prostate Cancer, which your oncologist may have given to you in clinic. Radiotherapy uses high-energy X-rays to precisely target the prostate and, where required, the lymph nodes. Some men will have had their prostate surgically removed before they have radiotherapy. If this is the case, the radiotherapy will target the prostate bed instead. Unlike normal cells, cancerous cells are more susceptible to the effects of radiation and so are less able to repair the damage caused to them by the treatment. This diagram shows you where the prostate, marked here in purple, is located in the pelvis. It sits very close to the bladder and the rectum. For those men who have already had their prostate removed, the radiotherapy will be treating the prostate bed. This diagram shows the radiotherapy pathway, starting with an initial planning appointment which includes a CT scan. This planning appointment will be discussed more in a moment. The next step of the pathway will be the start of the radiotherapy treatment itself. This is a daily appointment, usually Monday through to Friday with weekends off. Whilst on treatment, you will meet with a review radiographer for a chat about how you are feeling during your treatment, whether you are experiencing any side effects and how these can best be managed. After the course of treatment has been completed, you will have a follow-up appointment with your oncologist at around 6 weeks after the radiotherapy has finished. We will ask you to have a PSA blood test 1 week before your follow-up appointment. Now we will describe what happens when you come for your radiotherapy planning appointment. Your radiotherapy treatment planning appointment will include a CT scan. We ask you to arrive about 1 hour before the scan appointment time, as there is some preparation that you will need to do. Please try to empty your bowels on the day of your CT scan, although it is not necessary to do it just before the scan. If you have an irregular bowel habit, please contact us and we can give you some advice. We will give you the contact phone numbers at the end of the video. However, you should have a comfortably full bladder when we scan you. In order to prepare for this, it is helpful if you can be well hydrated for a few days before your scan and all through your radiotherapy treatment sessions. The best way to achieve this is to start increasing the amount of fluids that you drink on a regular basis. We encourage you to drink around 2 litres of fluid a day, which is around 4 to 5 pints. This can be drunk gradually throughout the day. On the day of your CT planning scan, one of the radiographers will come and meet with you, show you to the nearest toilet and ask you to empty your bladder. We will then ask you to quickly drink 3 cups of water while we explain to you what the CT scan involves. You will be asked to remove all of your clothes from the waist down and to put on a gown. You may prefer to bring your own dressing gown from home. We will scan you around 30 minutes after you have finished drinking the water. This is to allow enough time for your bladder to fill. The radiographers will need to see your pelvis area but will try to maintain your privacy and dignity as much as possible. They will need to manoeuvre you into the correct position, and it is helpful if you can relax and let them do this. You can breathe normally during the scan. There is no need to hold your breath, but you will be asked to keep as still as possible. The scan itself takes around 5 minutes. The radiographers will be outside of the room for the duration of the scan, but if you need them at all, just raise your hand and they will stop the machine and come into you. You will not see or feel anything during the scan, but you will feel the couch move slowly. Once the scan is finished, the radiographers will come back into the room. They will need to make some tiny tattoo marks on your pelvis as a point of reference. There will be 3 permanent tattoos, each about the size of a freckle. Sometimes the doctor will ask that an injection of contrast is given before the scan takes place. Contrast is a type of dye. This is not required for all patients, and you will be advised if this is needed for you. Please let us know if you have not had a blood test in the last 12 weeks, as we may need to arrange for one before you are given an injection of contrast. If you have ever had an allergic reaction to a contrast injection before, you must tell the radiographers beforehand. The injection involves having a cannula, which is a thin, flexible tube inserted into your arm or hand using a needle. The contrast is injected via the cannula. The cannula is then removed 30 minutes after the CT scan has finished. You may experience a metallic taste in the back of your throat or a warm sensation during and after the injection for about 20 seconds. If you start to feel unwell, raise your hand immediately so that the radiographers can stop the injection and check that you are okay. Once your CT scan has finished and the tattoos have been done, you will be free to go home, unless you have had the cannula inserted, in which case this will be removed. You will be given the date of your first treatment appointment, and this is usually for around 2 to 3 weeks after your CT scan. During this time, your oncologist will be using your scan to decide exactly where the radiotherapy needs to be given and to develop and check a treatment plan individual to you alone. Your CT scan is for planning the treatment only. You will not receive any results from the scan. No two treatment plans will be the same. They are planned for the individual using their own CT planning scan. These pictures show an example of a radiotherapy treatment plan. Next, we will talk about the radiotherapy treatment itself. On your first day of radiotherapy treatment, we ask you to arrive about 45 minutes before your appointment time. Please follow the blue signage which will direct you to the radiotherapy reception desk in the main waiting room. Report in to the radiotherapy receptionist who will show you where to wait. One of the radiographers will come and speak to you to explain the treatment process and provide you with a list of the first week's appointment times. They will ask if you have emptied your bowels that day and will then ask you to empty your bladder in the nearby toilet. They will show you the water fountain and ask you to drink 3 cups of water. The radiographers will call you into the treatment room 30 minutes after you have finished the water. This is to ensure that you have a comfortably full bladder for the radiotherapy treatment. This photograph shows the doorway to the radiotherapy waiting room and the reception desk in Reading. There is also a waiting room and reception desk in the radiotherapy department in the Bracknell Health Space. About 5 minutes before they take you into the treatment room, the radiographers will ask you to change into a gown. We provide hospital gowns, but these do not always fit well. You may prefer to bring your own dressing gown from home each day. You will need to remove your trousers, but keep your underpants on. This photograph shows one of the treatment machines. It's called a Linac. You will be called into the treatment room and the radiographers will help you onto the treatment couch. You will be lying in exactly the same position as you were for your CT scan. The radiographers will need to see the tattoo marks, and so they will lower or remove your underpants and cover you with tissue paper to maintain your dignity. The radiographers will adjust your position on the couch until you are in the correct position. You will just need to relax as much as possible and let them get you in the right place. You will hear the radiographers call out numbers and measurements to each other. This is to check that you and the machine are accurately aligned. Once they have everything set up correctly, the radiographers will leave the room to switch on the treatment machine from outside. The radiographers will be watching you all the time via the CCTV cameras, and they have an intercom so that they can talk to you if necessary. If you feel anxious or concerned at any time, raise your hand and they will stop the machine and come into you. The treatment machine will rotate very slowly around you, taking another scan to check your position on the couch. There will be a slight pause once the machine stops moving while the radiographers use the scan picture to check that everything is in the right place. They will then switch the treatment machine back on to deliver the treatment itself, and this will take another 5 minutes to complete. These diagrams are designed to give you an idea of what it will be like when you are having your radiotherapy treatment. The first picture shows an image of a man lying on the treatment couch underneath the treatment machine. Although it comes quite close, the machine will not touch you at all. The red lines indicate the beam of radiation as it passes through your body. You will not actually see this at all. There is nothing to see or feel when the machine is switched on, but you will hear it making some bleeping and whirring noises. The treatment machine will be moved around you to get the treatment delivered to the correct area. The second image gives an idea of what the radiographers see when you are lying in position on the treatment couch. The square area shows the area that the radiotherapy will treat. Some of our Linacs are fitted with a new piece of equipment called Align RT. This is a camera system that is used to detect patient motion during radiotherapy. Align RT will stop the treatment machine if it detects that the patient is moving, and it restarts the machine once the patient is back in position. You will not feel anything from the Align RT equipment, but you will notice that a dappled red light is shining from the cameras. It is safe to keep your eyes open if you wish, but please do let us know if you are light sensitive. The use of the Align RT camera system will require you to move a little more of your clothing, but your modesty will still be preserved. The next few slides will help to answer some of the questions our patients ask us. Radiotherapy is not painful and you will not feel or see anything during the radiotherapy, but you will hear bleeps and whirring noises as the treatment is delivered. Radiotherapy does not make you radioactive, and it is perfectly safe for you to interact with others, including babies and children, after treatment. The machine does not move on its own, it is controlled by the radiographers. The machine moves around you and gives treatment from different angles. You may feel anxious that you will be enclosed by the treatment machine, but although it comes close, it will not touch you at all. Once we have started the course of treatment, we aim to go through it without any breaks or days off. However, we know that circumstances do sometimes arise where either you cannot come for treatment or, for technical reasons such as a machine breakdown, when we are not able to deliver your treatment to the original schedule. If any treatments are missed, then they will be added to the end of your course, but we would prefer to avoid gaps in treatment wherever possible. The next few slides will talk about your weekly review while on treatment and the side effects that may occur. You will be offered the opportunity to meet with one of the review radiographers each week during your radiotherapy. This will give you the chance to discuss any concerns or worries you may have. The review radiographers can give you guidance and advice on managing any side effects of the treatment. They will work with other healthcare professionals to ensure that you receive the best and most appropriate care. The next few slides will talk about the most common side effects from radiotherapy given to treat prostate cancer. Not everyone will experience side effects from treatment. They occur very gradually and you are more likely to notice them in the second half of your course of treatment. They will peak at the end of treatment and may appear unchanged for the following 2 weeks. They will then gradually start to lessen and will have disappeared by 6 to 8 weeks after the treatment has finished. Radiotherapy for prostate cancer can cause irritation to the sensitive lining of the bladder, which sits very close to the prostate or the prostate bed. You may notice that you need to urinate more frequently and with a greater urgency. You may find that you get a mild burning or stinging sensation when you urinate, and you may find that the flow is not as good. Please let the radiographers know if you are having any problems passing urine. Drinking plenty of fluids is the best way to reduce the discomfort when you urinate. Water is best, and we do advise our patients to cut down their tea and coffee intake while having radiotherapy. Lemon barley water and cranberry juice can help to reduce any burning or stinging pain, but if you are taking warfarin, a blood thinning medication, you should not take cranberry juice. If you find, despite a strong urge to urinate, that you are unable to pass urine at all over a period of around an hour, you must go to the nearest accident and emergency department, as you may need to have a temporary catheter fitted. This is a rare occurrence, but it is important that you know what to do if it happens to you. The radiotherapy may also affect your bowel habit. You may find that you open your bowels more frequently than usual and that the stools are smaller in size and shape. You may pass more wind than usual, and you may find that your bowels become a little bit looser, and we will advise you what to do if this happens. The radiotherapy may also cause temporary mucus discharge and discomfort in the back passage and even occasionally some mild bleeding. Please do not become anxious if you notice these things. The review radiographer will discuss any side effects that you are experiencing and will suggest how best to manage them. Also remember that these side effects are temporary and will gradually settle down a few weeks after the treatment has finished. Radiotherapy can affect your energy levels and your motivation and emotions, making you feel tired or fatigued. Fatigue is an extreme tiredness. Tiredness can continue after radiotherapy has finished and may last several weeks. We encourage patients to carry on with their daily activities where possible, as there is good evidence that taking regular gentle exercise helps patients to cope better with tiredness and to improve the well-being of mental health. Equally, allow time to rest when your body needs to. To help you manage tiredness, try to plan your day in advance and incorporate some regular gentle exercise. If you are still working, you might consider working from home or alternating your working hours. Consider trying the complementary therapies offered at the hospital, such as mindfulness, aromatherapy and massage. You can ask the review radiographer for more information about this when you start treatment. It is also helpful to eat a balanced diet and aim to drink plenty of fluids. Again, about 2 litres per day, which is around 4 to 5 pints. During treatment for prostate cancer, many men will find they have reduced libido or desire for sexual intercourse. Many men will find that they have difficulty getting or maintaining an erection, and those who are able to may then find that ejaculation is uncomfortable. If there is a chance that your partner could become pregnant, you should use contraception during your treatment and for at least a year afterwards. This is because there is a small chance that sperm may be affected by the radiation during the course of radiotherapy. If you receive anal sex, then we suggest that you wait until any bowel problems or sensitivity in the rectum have settled down once the treatment is finished. Please don't feel embarrassed about asking your healthcare team about any concerns you may have. Now we will explain what happens once your radiotherapy has finished. Once your course of radiotherapy has finished, you will be sent an appointment to see your oncologist. This will be around 6 weeks after your last treatment. You will need to have a PSA blood test about a week before your follow-up appointment, and your review radiographer will give you a blood test form for this. We will make sure that you have contact phone numbers for the review radiographers and your clinical nurse specialist so that you can get in touch with us if you have any questions or concerns once your treatment has finished. We hope that you have found this information helpful. If you have any questions before your radiotherapy treatment planning appointment, please do give us a call on 0118 322 7872.